What if one of the most powerful tools for pain relief, immune balance, mental clarity, and full body healing was already thousands of years old, yet more relevant than ever today? Today on WellWaveNOW, we'll uncover how acupuncture is helping people activate their body's own medicine to feel better, recover faster, and stay well without pharmaceuticals or surgery. Our guest today is Catherine Niemiec, a pioneer in the field of integrative and Asian medicine. She's the president and founder of the Phoenix Institute of Herbal Medicine and Acupuncture, where she has led the training of acupuncturists and herbalists for nearly 30 years. With experience in accreditation, public policy, and clinical care, she brings unmatched depth to the conversation. In this episode, you will learn how acupuncture works, the wide range of conditions it supports, when it is covered by insurance, how to tell if you're working with the right provider. If you have ever been curious or skeptical about acupuncture, this is the episode to watch. Welcome to WellWaveNOW, your portal for actionable wellness insights. We, Breck Rice, Dr. Bob Levine, and I, Tim Daniels, are your wellness catalysts, committed to elevating your health, enhancing your functionality, and optimizing your performance at every life stage. WellWaveNOW, where timeless wisdom lights your wellness path.
Welcome, Catherine. It's great to have you on the show.
Hello, everybody. I'm excited to be here. This is a
Yeah.
thrill.
I thoroughly enjoyed the backstory we did with you, and I encourage all of our listeners to go back and listen to that backstory that is up on the YouTube channel and learn so much just in that short period of time. But I'm looking forward to jumping into the basics here and kind of getting rid of some of the confusion that there might be out there on today's topic. But before we jump into it with you, Catherine, I want to mention a word from our new title sponsor, and excited to bring to the WellWaveNOW podcast a new sponsor. There's been so much information and attention surrounding GLP-1s lately. And I think we've just started to scratch the surface on what some of the scary drug facts might be with some of the long-term use side effects of some of those blockbuster medications everybody's familiar with. And so we're happy to have our sponsor today, which is an all-natural GLP-1 called Brain IQ Fast Melt. So what if you could lose weight in less time with less money? And that's what today's title sponsor. So no painful injections, less than 1/4 of the cost of the prescription GLP-1s. And studies have shown that the weight loss is actually much greater. 28.1 pounds in 10 weeks versus 26 pounds on average in 40 weeks with the blockbuster GLP prescription. So all natural without any of the side effects. So we'll leave a link in the show notes for Brain IQ Fast Melt so that you can check it out. So back to the show. So Catherine, what is acupuncture?
Well, acupuncture is either and both a modality and a medicine. The way the term acupuncture is used, it can refer to just the act of putting a needle, a very thin filiform needle, as thin as your hair, a strand of your hair, into the skin. But it also encompasses a wide range of modalities because it falls under the concept of an energetic system of medicine that's been used for thousands of years. So acupuncture is just one of the tools of acupuncture medicine or traditional Chinese medicine or Asian medicine, however you call it. There's even Korean and Japanese forms of that medicine. And that medicine is comprehensive enough to include other things like body work, food and herbs, exercise, mindfulness, and energy work. All these things are methods to move energy around in the body to return it back to balance, because disease occurs when things get out of balance. Even the environment.
Catherine, on those lines, give us kind of both a Eastern and Western perspective on acupuncture. When we say energy, and you talk about moving around a balance, but to me as an old martial artist, type in Chinese martial artist and internal things, I understand kind of energy. But kind of break that down for the audience that doesn't understand what energy is in the body. And so talk to how that ties into the Eastern philosophy. And then I know you can bridge the gap and give it from to the Western medicine philosophy, what that really means from that perspective, as well as acupuncture becoming more and more accepted in the West as well.
Yes, so energy as we know it, you can turn on a light bulb with energy. You can feel energy emanating from your body. The sun gives us energy. Everything we feel, touch, or aware of energy. Even prayer as some say, is it energy? It's past, it's mental thought past. But for thousands of years in Asia, they studied people and felt and realized how energy moved. I think they had more time on their hands, and they were able to document these pathways of energy that are that flow the same on everybody, no matter what your size or gender. And so I have a man here. Excuse me, let me cover up part of him. I'll keep my hand right here. But there, if you can see this, there. Let me get him closer.
That's not going to work.
That's
Sorry.
not going to work. Well, you can kind of see.
Yeah.
There are these pathways of energy that run the same. Let me show the back even of energy. These are pathways of what I call bioelectrical energy, and they're the same. They're meridians of energy. And there's points along those pathways that are much more effective than a non-point place on the body. And you can actually manipulate energy to move forward, up and down that pathway. And so if you have pain in the shoulder, you might say, well, let's clear heat and inflammation. So there's a pathway that goes through the shoulder down to the hand. You might put the needle in the hand to draw it away from the shoulder. You can also put points around that shoulder area to release energy. And you can also put points around there to bring energy and blood to that area, because the blood will follow the flow of the energy, the magnetic flow, and fluids follow that as well. So there's a lot you can do to restore health to the body.
So why do you think acupuncture is so widely misunderstood for the Westerners, for us here in the West? I mean, even though it's been used globally for, centuries, why is it misunderstood here?
Well, first and foremost, you can't really see it. And so they think it doesn't exist. And yet there have been studies that show that things are affected when you put that needle in, and it can affect the energy and even remotely on the body from where the needle is, it can have an impact. And the concept of this energy flowing and the further concept of the mind-body connection to different parts of the body, which is different. Western medicine hasn't really studied that yet. It's so foreign and they don't study it. So there's this reticence to recommend it. But many physicians are recommending it now, and they are referring patients to that. And you have hospitals around the world where it's practiced with Western medicine.
Okay, so what is some of the scientific evidence or the research that somebody could go and investigate?
Okay, well, the World Health Organization and the NIH, the National Center for Integrative Medicine, they list all kinds of studies. Back pain, for example. In 2018, there was a review that showed that acupuncture was more effective than no treatment for back or neck pain, and more effective than fake acupuncture. They put a needle in someplace differently.
That was my second part of my question was, give us some examples of what you can treat with acupuncture. So back pain is one. Yeah.
Oh, everything. There's over 100 conditions.
You're acting like Dr. Bob now. You're rushing ahead.
I'm so interested in this topic. I need more information.
I'm with you, Breck.
But before we go to that portion, if I may, sometimes I never thought I'd have to herd in Breck, but Bob is just a wildcat out there that you got to try. There's Breck cutting loose today, but yeah, it still gets to me a little bit. What I want to understand a little bit, Catherine, and maybe some of our audience does as well, is the following. So like you said pain there. And if you take medication usually works in one of two ways when it affects pain, which is either to block the sending of the signal or to block the reception of the signal. How does acupuncture work to relieve that pain? And then tie that in a little bit, because like you said, it is accepted by more and more in the West here for pain relief of certain types. How would the doctors in the West just say, okay, just try it because we know it works, or do they have a different mechanism of action, describe it differently than somebody in the East would? Remember, Breck warned you. It's been about four weeks now, but Breck warned you that I ask compound questions. I just can't help myself.
You're gonna have to remind me if I missed something. So let's first talk about pain, okay? And you'll have drugs that will block the receptor, for example, so you don't feel it. But in Asian medicine, pain is energy that's stuck, okay? And if it gets stuck long enough, blood is stuck and it gets even more painful. What this medicine does is it disperses that blockage. So we don't worry about the receptors. I mean, that can help if it can send, put a needle at one point and try to send the energy through to the other end to go through and disperse that blockage. We can disperse the blockage by needling around the area. by massaging it. We can even use liniments to help break that up. There's a lot of ways that we can clear the blockage that causes the pain, what we call stagnant chi. So that's how that's different. What was your second or third
Well,
compound?
the second part, well, you talk about that's how in the West or in the East it's described as you disperse the pain, get rid of the stagnant chi, and then improve the chi flow on that.
Yes.
How would a Western medicine provider or practitioner describe what acupuncture does?
How would a Western doctor describe what acupuncture does?
Yes, in that saying that regarding that pain relief.
Yes, yes. So they might say, well, this acupuncture system of meridians is actually close to the nervous system, and so they think that it's kind of connected, and that it's part of the parasympathetic nervous system, and so that they can activate the nerve endings to help relieve pain or activate blood flow so that it relieves pain. So they don't really recognize the meridian system per se, unless they've studied Asian medicine. So they think it's connected to the nervous system or closely or next to it. And some of it does overlap or flow alongside that. Your hands up, Dr. Levine. What's up?
Yeah. No, this is all great. I'm really enjoying this because I love acupuncture. I think it's phenomenal. I think the Western medical people would say that when you have pain in an area, you're likely to have also muscles that are in excess contraction, burning energy.
Mm-hmm.
And I think that they would say that the acupuncture could allow those muscles to relax and release. And also, if they're linking it up to the parasympathetic nervous system, that can just calm the whole area down. I would say that's how they might describe it.
Yes, yes. And that is true, because in terms of side effects of what acupuncture does, that is exactly that. Exactly.
Okay.
So now can we get into the conditions that are most commonly treated?
So there's a list of over 100 conditions on the WHO website.
Wow.
That you can treat, because most disease is due to blockage or deficiency of energy or heat or cold, moisture, or too much moisture, dryness. So essentially, Asian medicine, acupuncture medicine, is physics in the body. Heat rises, giving you a headache. Water or moisture descends, creating dampness or urinary dysfunctions or low backache. So when you understand what the physics of what's happening in the body, you'll get a sense for what this medicine can do, because we're basically rebalancing all of that.
Mm-hmm.
So any condition, pain is the number one that sometimes people will be drawn to because it will take away their pain. But chronic disease, even cancer support, infertility, insomnia, emotional disorders, everything.
Let's go back to pain, because that's a number one topic for all of our participants on the Facebook group. So there's a large group of people, and that's the number one thing is pain or chronic pain. So unlike a medication that is just blocking that nerve sensation, what is acupuncture doing? Is it also just blocking that, or is it actually eliminating it?
Well, there's a couple of things. When we use acupuncture for, let's say you have to have dental work and we want you to stop feeling that pain, we can use that needle to help block that pain, that sensation. But very often, if you have that injured shoulder I was talking about, you can bring blood to that area, disperse the pain, relax the muscle, as Dr. Levine was saying, things like that. So
I might have missed it, but did you tell everyone that these acupuncture needles are really, really tiny, because I want to make sure that our audience doesn't think we're spiking them with.
I'm going to show you what this looks like here.
They are really thin.
Okay, this is just a longer one, simply so you can see it, but it's in a tube. These are sterile, one single-use needles. And here we go. This is it. Can you see this? It's the light shines on it, so but it bends, and it's like
yeah. You can almost
it's
not. It's so thin. You can almost.
It looks
not
big on the screen, but it's even thinner when I have it in front of me. You can't, and
No,
they're
no.
very.
We can see the thinness.
Yes.
Extending out of your fingers, which is holding the thicker shaft.
And there's different needles with different thickness and thinness and size and length, depending on where.
As I go through, I was been practicing self-medicine since I was a kid. I used to sterilize with sewing needles and pop my boils and pop my blisters. I could light the fire, sterilize them, and stick them right in there. But I could feel that. Now, do you feel these needles going in, Catherine?
Generally, you don't, but it depends on the technique and the intention. If you have a lot of stagnant chi in that space where you're needling, you might feel it because it's been stuck for so long, and you feel a sensation. Some people are sensitive enough to feel an electrical movement or charge, not like sticking your finger in an outlet. It's very gentle. but you can feel a sensation. Most people don't feel it. And depending on the technique, you might want to, some techniques will be manipulating the needle to really get in there. But generally, if it's done a certain way, you can just relax and fall asleep.
And
So
even if they feel that little electrical surge, that goes away really fast, and then they don't feel anything.
it can, but some people can feel things moving. And
Oh yeah, in terms of energy flow, but I'm talking about like, well, first of all, if the needle hits a nerve, my understanding is the needle hits a nerve, it can really cause an aggravating.
yes, so we reposition that needle and remove it and reposition it. And the skill of the practitioner and the training says a lot. The more
Right.
training, usually you can barely feel it, and also the style of acupuncture. You can
Right.
feel it.
And so we want you to take us into that style and how to find a good practitioner a little bit in the segment coming up. Now I want to really get into more in the segment about what it's actually doing in people's lives, what it helps and how quickly it works and where it fits in overall care. You talked about what the over 100 conditions on the World Health Organization's site that talk to. Well, what would you say, let's say in the US, are the top conditions you see acupuncture helping most? And what results do patients typically experience in that regard?
Yes. So top conditions, pain, of course, allergies and asthma, cancer support.
Okay, hold on. So you mentioned cancer support twice.
Yes, yes.
What does that really mean, Catherine? Is that pain relief during cancer?
Pain relief, any kind of nausea after, chemotherapy, re-strengthening the body because chemotherapy's kind of killed a lot of stuff and you have to rebuild that in your body. So there's a lot it can help with. Gynecological disorders, depression, anxiety, sleep, insomnia.
Okay, and then gynecological disorders, what we do?
Oh, well, for women, PMS, you don't have to suffer from that at all. Helping to clear out fibroids, helping to get pregnant. And if you have a baby that's breech, you can help reposition that baby while it's in the womb. Things like that. It helps start contractions when you need to. So
Those are very cool results for women who are in a situation which they would otherwise not be happy with, and then they can
yes,
get the acupuncture. It's really amazing when you see
Yeah.
some results you can get from that.
yes, definitely.
I'm certain there's different approaches, right? For a different, like chronic pain, you're going to approach that differently than you might for fertility, for instance. So explain that.
Well, for chronic pain, uh, anything chronic that's long term, you got to look at other things that are happening in the body. Certainly, you can focus on that area of pain, but usually, sometimes pain is because you don't have enough blood in your system, so to speak, and not in terms of quantity, but quality of blood to nourish and bring blood to all parts of your body. If you're sort of like anemia or blood deficiency, you're not going to have enough blood. The body conserves it in the heart to keep you alive. But your hands might be tingly, your feet might be tingly, you might be dizzy because there's not enough blood to get to those areas. And without that blood, you might have a headache from that. Likewise, infertility, a lot of women have coldness in the lower abdomen womb. I mean, we drink a lot of ice cold drinks like he might be doing right now. I don't know if that's hot or cold, but that creates a sensation or a temperature of coldness in the lower abdomen. And you need to have enough warmth in there for life to happen, to be created. And so bringing warmth to that area through herbs or acupuncture or even using a TDP lamp over that area to help.
What's TDP?
Well, let me just break it up. It's just a heat lamp, so to speak. Okay. And so putting heat into that area, even chai tea, because it has ginger, cinnamon, and cardamom to drain the dampness. Those are things that can help improve your chances of fertility because it has to have the right environment. Same thing with colds and flus. We call that a wind evil that comes in because it goes from your nose to your throat to your lungs. We need to clean out that environment so whatever virus, which they can't see, can't thrive. We clear the environment that makes it a situation where the bug can't survive. So those are things that we do.
Can you say something about inflammation as well? I'm curious about it. Everybody's talking about inflammation, and that's the source of every problem that every human being on the planet has. So what can acupuncture do for that?
So inflammation very commonly shows up as heat in that area. So we can clear the heat in that area. But that heat can come from actually either excess heat or being so dry that it creates its own heat. So if it's that dry, we add moisture. Like our body's like cars, and if we run low on oil, we'll overheat inflammation. And so by adding yin, You heard of yin and yang. Yin is the moisture. Yang is like the heat and the combustion. So if you add oil in the car, whether it be in our stomach inflammation, because we don't have enough oil in there. Let me back up. I'm digressing, but this is important. If you drink ice cold drinks and put it into that cooking pot of a stomach, so to speak, it has to burn hotter in order to get rid of the cold. When that cold is gone, it's burning too hot and it dries out the inside of the stomach. If you dry out those fluids and those oils, so to speak, if you don't have oil in the frying pan, whatever you eat might cause inflammation or a food allergy. People have reactions because their digestion is too weak. And one of the ways that we know this is when you stick out your tongue. The tongue is like a map of the body. And the different regions of the tongue, if you stick your tongue out, the tip is your heart and your lungs. The middle is the stomach. And some people have a crack in that area of their stomach, like the earth forms a crack on the surface when it's dry. And that tells us there might be dryness or inflammation in the stomach. And how can we relieve that? So we will give a tonic, an herbal tonic that adds yin or fluids, but we'll do small doses so we don't flood. You don't want to have a flash flood, because Arizonans understand that, but that is, the earth is too dry and the water just stays on the surface, just enough to a drip system so that we get this green lawn, back to normal. So anyways, I use a lot of metaphors here.
Yeah, but Catherine, you're starting to sound like my old martial arts instructor.
Okay.
Is actually was world famous, and his father, Peter Kim Ho Chu. But you do a lot of the West, and so I'm hearing you and I'm identifying with this, the hot and the cold, the rainy, yin and yang. But a lot of our audience is very Western oriented, and sometimes it sounds like this is like I used to watch a lot of Westerns when I was a kid, and you'd get the guy up on the wagon, and he'd hold up the patent medicine thing, you drink this medicine, and the snake oil, and actually there was the real snake oil that you could use, but most of the stuff is fake. You drink this snake oil, and it's going to cure your ills here. But now, you point that there's scientific evidence, and our folks go take a look at that. But I think this is also might be the point to bring up to the audience how you first got introduced to the Asian medicine and how it helped you. So how it first became, isn't just philosophical with you, there was actually a real experience with you, right?
Yes. Well, I grew up in Arizona and then went to law school in San Francisco and became a lawyer. And the cold, damp weather of the Bay Area getting in my lungs combined with stress, I kept getting bronchitis. So I had the good fortune of having a nurse practitioner say, well, if you really want to get well and get off all these antibiotics, meet me in Oakland's Chinatown. And I went there and sat in front of a gentleman who didn't speak any English. He just looked at my tongue and he felt my pulses, like 3 pulses on each wrist, to figure out what was happening in each of my organs. And he wrote out a prescription. I took it to the counter, came home with a bag of twigs and leaves and put it in a pot with water. It starts cooking and smells pretty strange. And I strain it and I drink it. And literally within minutes, my lungs cleared from just that small amount of liquid. And I went, oh, what is this? And I went on to study this and realized, and looking at it with a very critical and analytical eye as I was trained by them, and I found it made a lot of sense. It was a very logical medicine. And it was the missing piece to the Western medicine that I've been so used to, that the two together really give you the more complete picture of what's happening. Because you look at the human body on this fine gentleman here, and you see that whatever's here connected in the head is connected down to the toe. You see relationships that Western medicine doesn't, because they have a different doctor for the ear, a different doctor for the foot, right? But when you see this all connected, you go, there's too much heat in this whole pathway meridian. And so it's a completely different perspective by looking far enough away. You see the elephant, it's an elephant, instead of looking at it's a big wall or a tail or a tusk. It's the whole picture. Yeah. And when you combine that with the technology of Western medicine, the ability to look that close, you really can take care of a lot of things. So I think you need both.
Yeah, it's amazing that we've gotten away from, you look at Ayurvedic medicine, traditional Chinese medicine, all these great American Indians. All kinds of, there's so many different types of natural, historically relevant approaches to healing. And we've gotten so far away from that. But the whole systems of evaluating what's going on in the body and then treating it as a holistic system makes so much more sense than having the specialist here and the specialist there, and not really talking to each other. I can go on and on about that from my experience in healthcare systems. But in any case, I just acknowledge that what you're talking about makes total sense, and people should really be open to checking it out.
Well, in fact, the general public is. They're looking at it, they're finding their own practitioners because they're piecing together what they need and what seems to work for them.
Yeah.
And and the other missing piece is the effect of nature, because these other older medicines still look at nature as an influence, too much heat, too much dampness, and the wind affecting our bodies. And then the mind-body piece, that anger and frustration affects the liver, and too much overthinking affects our digestive systems, and grief or sadness affects our lungs, and joy or lack of joy affects our heart, and fear affects our kidneys, and which includes the bone structure all the way up to the brain, the skeletal structure. And I never realized what that connection could really mean. And that if you have too much of an imbalance physically, it creates those emotions, and vice versa. Too much of the emotions can cause an imbalance. That's one of the biggest pieces.
Now, Breck, a couple minutes back, this look came across your face like you had something to add. Did you have something to add or a question?
No, well, it was just an aha. I've been mispronouncing yin and yang. I was saying yin and yang, right? I think a lot of people call it yin and yang. And then to the answer of your question, what I was drinking was room temperature structured water with a little bit of mineralized salt in it for my electrolytes. So
Guys,
How much salt do you add to your water?
just a pinch.
Now, I want to get to insurance with you, but let's tie it back a little bit again to just reiterate, because we covered a lot since we asked that question on there, as to what are kind of the top things that people are coming to acupuncturists for, of that 100 plus type of things going on there. And then of those, if you could talk about what is really being covered by most insurance in the US these days.
Well, I'm sorry. The list is so huge, and so any kind of pain, you name it.
Mhm.
If you have to have surgery, we can help you recover twice as fast, honestly, because it'll speed up the healing. But in most cases, we can prevent surgeries because we address the issues beforehand, before it gets to the point of needing surgery. So this medicine in its various forms can really handle everything from birth to death. And living well. Longevity is one of the biggest things, anti-aging. If you keep the body like a car running well, it will go for a long time. And so if we can bring ourselves into a state of balance and return to balance when things throw us out of balance, it's very meaningful. Yes.
I was wondering at some point, Tim, will we address movement and how TCM, traditional Chinese medicine, approaches movement and the importance of movement? And also, I have to ask you a question. I saw a book about 30 years ago that showed how the traditional Chinese medicine deals with joint mobilization, almost like a chiropractor. And I've never seen that book again. Have you ever seen a book like that?
Okay, well, hold on. So we got the book, we got this movement. We still haven't let Catherine answer the one question that, so every time we all have our different modalities we go out there and talk to people about. What's the first question that, especially those guys, Bob's age, and Miriam might ask, is this covered by Medicare? Is this covered by insurance? So, but I even have people who are in their 20s saying, is this covered by my insurance? Because people,
Yes.
you spend money to go to the gym,
You have to pay for it.
supplementation, you're coming out of pocket, but they want to know anytime they get one of these type of things, is it covered by my insurance? So if you would, Catherine, for what you know, when is this covered by insurance? And so people can kind of say, yeah, if I've got this, I can look at my insurance. If I've got that, I know I got to come out of pocket.
Yes. Okay. So there are ICD-10, if you understand the insurance. There are codes for insurance right now. And so practitioners can bill for that for you. You can go see someone. If they don't bill the insurance company, then they'll give you a super bill, which you can get reimbursed by your company if they cover it in their policy. So check your policy. Medicare, still working on it. There's actually legislation in process now for that, but Medicare Advantage will usually cover that. And the new ICD-11 codes, the next version coming out, traditional medicines are covered in that and using their own language, which is
But
great.
coverage for what? They cover if I go and I stub my toe, is it paying for that?
Usually for pain.
If it's the cancer support, does it cover the cancer? Does it cover when it's cancer support, or is it really pain, migraines, that type of?
Yeah, well, usually they want us to use Western terminology
Yes.
in that, and so pain's probably the top thing. However, in ICD-11, when it comes out, we can we will be able to bill for yin deficiency, which is going to explain a lot of things like that. And so, oh yeah,
2026,
it's, pardon me?
is that next year, 2026,
Well,
or?
they've already been promulgated, and it just depends on acceptance and use. So
Okay.
if you go to the WHO website, they will talk about that. But you, as with any other healthcare treatment, sometimes you talk to the practitioner, they have non-insurance rates, and especially if you go to the colleges, they have clinics, and it's even a fraction of the cost. So I invite you to
Health savings plans, I'm sure, would cover it.
Yes, yes, yes.
Private insurance will cover it.
Yes, yes. But a lot of people pay out of pocket, and they work out a package deal with their practitioner, for example, because usually it takes more than one treatment to achieve things, although you can feel experience right away. With regards to Dr. Levine's question about fitness.
And I'm gonna modify
Oh,
that
okay.
question. I'm
Tim's
gonna,
always stepping on my questions. Go ahead, Tim.
I was going to answer
like
his
that.
question.
You know, Bob likes me to step on his questions too. It rouses him up. It gives him energy, and he's ready to go. He likes to get into it and mix it up. But the only way I'm going to modify it is go back to. I'm going to add what we also talked about earlier. So we want to put this both in, because you're unique in that you can bridge the east and west worlds. Put it in both contexts of is I guess we're really asking, acupuncture the end all, the be all? Or do you put it in, what's the context you put it in? How does it fit in with other parts of traditional Chinese medicine or traditional Asian medicine? And how does it fit in with other Western philosophy, other Western medicine practices? So where's it fit in that world? How do you use them together? Do you not use them together, and how?
Well, here's my lawyer answer. It depends. Okay. Because acupuncture can be useful, but sometimes you can't do that. And for whatever reason, if you're not with a person to help them, and sometimes you need more consistent treatment after you see them. And so I'm a big fan of herbal medicine and study that extensively. And herbs are almost like food. They can, in terms of taking them regularly or just certain kinds of herbs for just an acute condition. And you don't take it all the time because it'll push you out of balance, like a drug. You don't keep taking that drug all the time because it'll push you out of balance in the other direction. So again,
ask Breck about that.
Yeah, it can happen. So you have to know what you're doing, and you have to know the energetics of the herbs and match it to the person. Cooling herbs, moistening herbs, things like that. So heat right now in Arizona, chrysanthemum tea or peppermint are very cooling. You don't want to take a lot of the hot stuff because it can create more heat. So and now in terms of using that with other medicines, again, it just depends on what you're using it for. You can take herbs with any kind of condition that's being treated by a Western doctor. However, if you are on pharmaceutical drugs, it's important to know what you're doing because you might exacerbate or antidote the effect of what you're doing. So it helps to have a practitioner give you some advice or do your research and figure that out. So
Yeah.
Dr. Bob, did you ask about movement as well? Or we just
Yeah, because obviously movement is hugely important in my view to go along with everything else that we do
yes.
as a multimodal strategy to help people get better from whatever's going on. I brought up that book that I saw about how TCM, traditional Chinese medicine practitioners, will do joint mobilization, wrists, elbows, shoulders, back, spine, hip. And have you seen a book like that? Because I've never been able to find it.
Well, let me just say this. Movement is important because it keeps the chi moving. It is the number one anti-aging thing you can do because you need to get blood to all the organs. And as you get older, you produce less blood. So at least by moving, you keep the blood nourishing all those organs. So in terms of joint mobilization and things like that, in the early textbooks, we are still using the textbooks from thousands of years ago, translated to English. And they knew how to adjust the bones, and they were the original chiropractors. When they came to build the railroads in the United States, they were adjusting each other's necks and backs, and that's kind of what inspired, I think, chiropractic medicine. So you have to have things aligned for the chi to flow best. When things are out of alignment, then it's just not going to be flow or might even be blocked. So you need a little bit of both. So I regularly see a chiropractor, or you can get someone that does Tui Na, which is the Chinese version of that adjusting technique. And
How do you spell that?
Tuina. Tui Na
Tuina.
is yes. So if you find that kind of practitioner.
Very interesting.
Mm-hmm.
see, Bob's an experimenter. I could tell you how much Bob experiment with, but you'd have to bring up your anatomically correct guy again, because, but I promised Bob I wouldn't talk, and I wouldn't spill the beans on that one, so I won't, but he's an experimenter. And he likes to really see how these things work and try them out on himself and working into his field.
So, Dr. Bob, there's a Dr. Greg over in Hawaii that Tim and I spoke with that does some deep tissue pressure point type stuff that is also manipulating the limbs that kind of goes hand in hand with what you were asking about. But, in our next segment, we want to cover safety, red flags, and then finding a qualified practitioner, right? And before we jump into that, Dr. Bob, did you get any of this yet?
I'm sorry.
This
I
is
have not
called
got it.
NeuroGum for those that are listening. And NeuroGum is natural nootropics for energy and focus. I always feel more energy and when I chew it and have more focus. With natural caffeine, vitamin B12, B6. It has the amino acid L-theanine that's also known to improve cognitive function. It's sugar-free, tastes great, and it's refresh your body and your mind with NeuroGum. You got to get you some, Dr. Bob.
Yeah, let me ask you a question. If I want to find out a link to that, is that going to be on the YouTube channel?
Yeah, we have the link in the show notes, and it's also available in the TikTok shop for those listening live on TikTok. So
Cool.
let's get into now, how to pick a good practitioner, and let's help people feel comfortable and kind of take the uncertainty away. And that's something you have some experience with, Catherine, right? Because you actually provide credentialing services, correct?
Yes, and we helped establish the statutes in the state to set those standards as well. Well, because this medicine is originally a people's medicine, and in Asia, they take care of their own families, and then if they can't bring them to balance, and they go to the next level practitioner. And so there's a lot you can do on your own, just learning about how to balance the body. You can even do acupressure on your hand. There's a point in there that's very good for digestive issues right in here on the wrist. So you can learn some of this. Yet the skilled practitioner who uses the needle, and the nice thing about a needle is that you can place needles in different places so that the energy as a whole flows together. And every time you get a treatment, you're telling the body, go this way, and the body will start to adapt and adjust to stay in balance more and more. So, and that's for like chronic conditions. Acute conditions, you might need more work that way. Well, the thing is that it takes a lot to learn this medicine, to understand what you're doing with the energy and what the organs do and all the things around it. So our programs are master's and doctorate degrees. They're 4-year degrees for, thousands of hours, 2,000 plus hours and more, especially if you learn the herbal medicine. And yet there are practitioners that take a weekend course, okay, and just a little bit of training, and they call it different kinds of needling, and that can help, but it's not as fully trained, and there's a lot more safety concerns, I think, with that, and puncturing the wrong, you don't want to puncture the lungs and do these things and that. So the fully trained practitioners are licensed acupuncturists, and they can have a master's or a doctorate degree in acupuncture. And so look for a state licensed acupuncturist, an LAC, or an acupuncture physician if you're in Florida, or a doctor of acupuncture medicine in New Mexico, just different titling in the state. So,
is there a directory that people could go to?
Well, yes, you go to the state acupuncture board or the state acupuncture association and find their directory and find somebody. There's also a national certifying body, the National Commission for the Certification of Acupuncture and Oriental Medicine, or now Herbal Medicine as they're calling it, NCCAOM, and find somebody in your state, in your zip code. And they can be an acupuncturist or an oriental medicine, which includes the herbs. So find somebody who knows that stuff.
Do I look for a LAC or look for Oriental medicine doctor? I look at the directory.
Yes.
What are there questions that you would also then recommend a potential patient ask of that practitioner before they go in?
Well, besides knowing what kind of acupuncturist they are, if they've also studied the herbal medicine, I like that, because that, to me, you have to learn more internal medicine as well. So I like that, but those skilled practitioners can handle a lot of things. So they should be licensed, but then ask them, have you dealt with this syndrome before? What's your experience with this? Okay, and see. And, find someone that maybe your friends recommend if somebody has had good experience. And more importantly, find somebody that you can communicate with, that you feel comfortable with, and that you can develop a trust, because they're working on you, and you want to be able to explain and let them know what you're thinking and feeling, and so they can better adjust the treatments as they go along. Because as you get better, your treatments will change and your herbal formulas will change. So,
Catherine, do you just teach or do you practice?
oh, well, I've been too busy running a school, so a college. I can certainly talk to anybody about that, and I might
Okay.
have a small private practice on the side. But in general, I have a highly qualified team of practitioners and students. When if they came to our college, we have our students have more training than a medical doctor does in this medicine by the time they get to clinic. And so
Wow.
they are very highly competent and they can take care of just about anything.
Wow, that's impressive. So smarter than Dr. Bob then.
Oh, well, I don't know how much acupuncture training you had, Dr. Bob.
I went to the Dr. Joe Helms
Oh, very well
medical
respected.
acupuncture for physicians. I'm probably the only PhD I think that ever took that program.
Attended, yeah.
And they teach a French energetic style, which is a little bit different than the traditional Chinese medicine style. So,
It's true.
yeah.
So when Breck and I come for our sessions, you turn this over to a first week student, or who you turn this over to?
Yeah.
And they're
We're going to be the guinea
supervised
pigs.
too. Yeah. So
Yeah. We've never tried this technique before. It takes a, yeah. Looking forward to
they're
that.
really good. Great.
Well, so let's
So
kind of, I want to kind of wrap it up here, and let's zoom out a little bit.
I just want to, Tim, can I jump in since we
Go
have
ahead.
so I wanted to ask you about auricular or ear acupuncture. I think it's really valuable because
Yes.
people can actually walk around with for days with these little auricular
Tacks. Those are tacks. Those are not needles because the needles will fall out.
yeah, just
So-
a little ball,
Yes.
right?
So
Kinda
the
like-
ears, the hands, and the feet are circuit boards for the whole electrical system. So you could just work on the body through the ear or the hands. I don't have a model here, but this is a hand model. You can see all the points that affect the body. We have them for the ear and the feet. Now it's hard to needle the feet, so a good person who does reflexology would be very nice and feels comfortable. But the ear is a circuit board. So if you imagine the ear and this, the head, and then it's like an upside down fetus, and all the internal organs are on the inside. Those points, you can treat the whole body. But
Yeah.
5 points on that ear are so effective that the drug courts in, for example, Miami-Dade County, Florida, said you have to get acupuncture in those 5 points or go to jail because it helps them stay off drugs.
Oh,
Those
wow.
are the same 5 points that we use in emergency, disaster relief, and helping first responders because it calms everything down and they can go to sleep at night. It takes the anxiety and the shock out of their system.
That's a big deal what you just said.
It's
My
big. And
goodness, that's a whole nother episode.
and
for,
addiction,
but
yeah, and it helps.
recovery. Wow.
Yeah,
Also-
addiction recovery. So all that stuff.
How about I'm really interested in addiction recovery too.
Yeah, we can work with that.
I'd like to connect with you on that at some point. My
Wow.
question, my last question is, Tim, thank you for letting me jump in here, is and I forgot my last question. No, I think I did. Let's see if
I
I
can
can
point for that, a memory point.
if I can pull it back. Yeah, can you help me, Tim, with that?
Neurogum, Dr. Bob, neurogum.
Yeah. No, I got it. I pulled it back in.
And use that PEMF on your head too. Use that neurogum and PEMF on your head, then bring it back to
Well,
it.
I heard that you're not supposed to use PMF on your head, even though I do it anyway.
41 in every other country but the US, they say do it.
Isn't it crazy? Yeah. Okay. Now I forgot and regained it again just now. Now my question is, can you teach people how to do acupressure on themselves using remote therapy? Like if you can do an intake on somebody over the internet, and then you can tell them where they might want to use acupressure.
Yes,
to
of
affect
course. Yes.
Okay, I'd like to hear about that briefly.
Well, telemedicine, especially during COVID, we had, our clinic was kind of shut down for a while. So we would do telemedicine sessions, and while we could prescribe herbs that were very effective, we could tell them which points to do on their hand. Like there's a point in here to eliminate heat throughout the whole body. There's points to strengthen, things like that. And those are points that we would needle if we were in front of us. So we could teach people how to do that and do that type of a point prescription. At first, I thought you were asking about training. Obviously, if you don't, you can go to school to learn the whole medicine, but we do offer training just in those 5 points in the ear, and we have special licensing in Arizona for that to be an auricular acupuncture specialist.
You're training those 5 points. That's it.
Yes, and they work with other acupuncturists to help in addiction recovery centers.
Wow.
Because you need a lot of people to help a lot of people and disaster recovery. So we can do that. And you can learn that and just work on that to help people. But yes, individually, we can talk to people about how to do that.
Can you use acupressure on ear points too?
Yes, absolutely. Absolutely.
Right.
And stimulate
So
those points.
Sorry, this is way off topic here, but you brought it up with the addiction recovery, and of course, Dr. Bob and I are super interested in where that can help. But it also would seem that there could be some evidence in counseling as well, therapy.
It goes with hand in hand, hand in hand. That's why the drug courts had those people do the 12-step program along
Yeah.
with that. Yes.
Like EMDR is something
Yes.
that's coming like a storm to help patients in therapy. Why not add the ocular?
What is EMDR, Breck?
I can only explain it. It's
It's that kind of eye
following
movement
eye
recovery. Yes.
movement. It helps reset the brain, basically.
Anything you can do to get the person back in their body, because so many times
Yeah.
we're just kind of operating up here, back in the body, out of anxiety and fear, fully present. Meditation can do that, but it takes a while to get there sometimes. So this can almost get you to that point. Then you're fully present to look at your issues and to resolve stuff and to see things differently and see opportunities and change. So
And I see Dr. Bob wants to jump in again, but it's my job here to be that guy. Yeah.
I'm jumping in.
Yeah, you got Breck and Dr. Bob, and you can be
EMDR.
also enthralled with his acupuncture and the full scope and all these things. And we're going to have you back. We're going to have you come back on homeopathy, which is one of your other
yes, I can talk
other
about
forms of
that.
urban medicine. But we have to come back and have you dive into more acupuncture for Bob and Breck. But in the interest of time here and where we're at, I gotta pull us out, Bob and Breck, and I got to zone in here with a couple more things. One of the things that so we're going to get towards our wrap up here. But one of the things you talked about also was either part of this whole thing, the acupuncture can affect, is longevity and overall health. Talk to us about if you can. I don't know if you're familiar with PEMF, pulse electromagnetic field therapy, but massage therapy, back on Bob's movement. From the longevity perspective, what would you add into the mix? What does acupuncture bring to that longevity? And what would you advocate from your own realm of knowledge that you kind of focus on to add to acupuncture in that regard?
So whether or not you get acupuncture itself, the needling, there's other things you can do. If it's massage, because you'll hit those points, to move areas that are stuck or weak, walking, moving your body, and food that are the right food for you that you need, the right energetics. You need warming food, cooling food, whatever you need, and your mind.
You're starting. I know I slowed Bob down. I gotta comment here because you're starting to sound like my wife. She's a seasonal eater here. Says I can't eat this in the winter, and I don't. This is not a food. Chili's not the food for summertime. I eat chili and hot food all year. In the Arizona heat, I'll eat that hot food. But so you're telling me I'm doing something wrong there, huh?
Well, whatever you do, and we eat whatever we want as Americans, so we just have to learn how to go back to balance. If you eat too much of the wrong thing or so forth. But my last comment is to try to sit and not think, which is meditation. Because the more you do of that, the more your body energy will flow normally versus getting stuck in your chest or in your shoulders or your stomach, because that can throw you out of balance. So the more you are relaxed and fully present and meditating, and that'll help you sleep as well, your body can actually stay more normal longer, so to speak. You're in sync with everything, and everything just flows better. So
Catherine, what is the future of acupuncture here in Western medicine in the next 5 to 10 years?
it's changing. I think things are changing. I think people are seeing things differently. The public's already ahead of the game in terms of the systems. The next step is, do our systems change to embrace, accommodate, or open up? I think the Western medical system is being affected or blown apart a little bit by some of the awareness that we're getting about too much medication and the insurance system and hospitals and things like that. And so there's an opportunity for good things to happen if it can happen the right way, where these medicines are brought in. Already the hospitals, their accreditors are telling them, bring in non-opioid options like acupuncture. But you have to change the way you see things and think and be open to these things to allow them to do their work. Okay, so the public is aware of it. They're doing it on their own. If the systems that we know, insurance and hospitals can get more on board with this, and even governmental regulations, even in the schools, even in restaurants and things, and anywhere that balance can be obtained through this. We're starting to see more of those drinks out there with herbal supplements and adaptogens in them as an alternative to alcoholic drinks. So we're starting to see it creep into different areas, and we'll see, and see where it goes. But the things flow where the mind goes. So if we can envision the right kinds of things, it can happen.
Okay.
Yeah.
And in that envisioning, and you mentioned also be open to things.
Yeah.
What's to help people do that or achieve that? What's the one insight you'd like to give them on acupuncture that they might not be aware of or considering at this point, even after all we've covered here?
Oh, acupuncture is one tool of a whole system of being able to look at your body and seeing it's how it operates in the world in connection with everything, including your mind and body. And so start looking at this and pursuing it. Look it up on the web, research it, and try it. Try different pieces. There's any point of entry, whether you talk to an herbalist or you read a book or you try acupuncture or you get body work and get shiatsu or acupressure. Anything can be a starting place for looking at this. Okay, so just start looking, start trying, and see what happens.
All right, Dr. Bob, thank you. Any comment? No more questions, but any comment you'd like to give Catherine?
Oh yeah, I think we should have her back. I know we should have her back because this is a rich topic. There's so much to it. And there's so many areas we can continue to travel in our exploration of the knowledge that she has. So yeah, I'd love to have you back, and it's really fantastic to have you here with us today.
Yeah.
Thank you. Such a pleasure to enjoy conversing with you.
Yeah, thank you so much, Catherine. And thank you for giving us clarity and wisdom on, a real look at how acupuncture fits into today's wellness landscape. And to our listeners, whether you're already using acupuncture or if you're just considering it, remember your body is designed to heal. And so this is a tool to actually get there. And so stay curious, stay open, and stay empowered. And be sure to also follow the WellWaveNOW and visit our wellnesswaveclub.com. A lot of resources and information for you there to help with your, path to wellness. And always remember, wellness, it's in you.